The FDA is expected to authorize a Pfizer COVID vaccine for children as young as 12 years old as soon as next week.
More than 2,000 children ages 12 to 15 who took part in Pfizer's trial found the vaccine was 100% effective.
Lots to talk about at our weekly visit with UW Health's Chief Quality Officer, Dr. Jeff Potoff. Good to see you again, Doctor.
Hi, Dr. Potoff. Good to see you.
Good to see both of you.
How big of a deal is this for 12 to 15-year-olds to be able to get the shot?
You know, this is a big deal. I think, on a couple fronts. One, I think all of us want to see our children protected against this disease. It affects them less frequently, but nonetheless, there's lots of sad stories of children being affected. And then secondly, this helps us get closer to herd immunity. There's about 5 million kids in that group that if we can get a lot of them vaccinated, sets us well on our way toward trying to reach herd immunity.
Well, it's one thing to get a vaccine for yourself, but when you're talking about getting a vaccine for your child, what do you want parents to know about that?
Yeah, I think, we want to see the details of the safety data. That's being reviewed. The efficacy looks to be tremendous. Usually in these situations where it's very effective for adults, it's usually very effective in this age category. And as a parent myself, I just take some heart in knowing that, pretty soon I don't have to worry about my kids being in school. If they're going to get the virus, they'll be more easily able to participate in some of these sporting things that have some risk right now. It just really does a big thing towards improving the quality of life for our kids because they can get back to the things that kids love to do.
We're doing a lot of reporting on things reopening, the Chicago Auto Show, the Dane County Fair. Are we going too fast here?
I think we just have to be careful. There is a lot of good news with cases, decreasing, with vaccination rates increasing. But, we can't put the cart in front of the horse. We have to be very careful that we're using science and the current numbers to direct our decisions and not just our wants and needs, which at this point, everyone wants things to be wide open. I'm hopeful we won't slide backwards, but there's always that risk of things getting worse if we're just too aggressive with our opening.
We've received several emails from viewers expressing a little bit of concern that they've been fully vaccinated, received 2 vaccines, and then got COVID. How is that happening, or why is that happening?
Yeah, it's certainly not common, but there are a couple reasons why it can happen. One, no vaccine is 100% effective, and with hundreds of millions of people vaccinated, the number of people who could still be at risk for getting COVID, albeit much milder, is there. You'll hear stories. Secondly, we have some variants floating around the United States. The most common being the UK variant. That's not the one that typically reinfects people, but that South American, the Brazilian variant, as well as the South African variant, they can cause mild disease in people, even if they're vaccinated with a Pfizer or Moderna vaccine. So these stories, not unheard of, although not common.
But you're not getting as sick and you're not getting hospitalized. That's the point, I think.
Absolutely.
What's going on in India? Why is there such a wave there right now?
Unfortunately, my heart breaks for the folks in India. And what it is, the realization of our worst fears back last fall when we were worried about what would happen if we had so many cases that our healthcare system couldn't keep up. 2 things in India. One, their cases are out of control. It's hard to even think about containing them. 2, their health system is overwhelmed. And now you see the results of that, huge numbers of deaths, lots of suffering. One of the things that we knew would be said if we did a good job during this pandemic is the naysayers would say, hey, you overreacted, it didn't get that bad. India is an example of what happens when it does get that bad. And just, thankful here in Wisconsin, we didn't have that happen.
Even with a travel ban in place, are there any fears that it could cause a second wave here in the United States? Or are those of us who are vaccinated, will we be protected from that?
Vaccination really is the key difference there. If we didn't have vaccination, I would be a little bit worried. Travel bans, although probably the right thing to do, it's hard for them to be 100% effective just because people are so mobile, in 2021. But I'm hopeful that with, high rates of vaccination, people still wearing their masks, keeping their distance when they need to, we can avoid a resurgence here in the United States.
Well, that is the important thing right now because we're making great progress.
Yeah, we have a lot of good things going right now, and I think that makes it easy to want to throw the doors wide open, and I'm right there. I'd like to have that too, but, let's take this a day at a time, do this the smart way, not have us take steps backward, have life get more restrictive. None of us want that.
All right. Good to see you again, Doctor. Some good news for a change. We'll see you next week.
Thank you, Dr. Potoff. We appreciate your time.
Thank you. Bye.